Hello and welcome to my page. My name is Margaret, a plastic surgeon living and practicing in Nigeria. In today's video, I'm going to be talking about keloids. Keloids are scars. I'm sure you've seen some people who look like this sometimes, something like this. You've seen it before. So that's what we call keloids. And for those who have keloids, they can attest to the fact that it is a big problem. It keeps coming and going, and you have a treatment and it comes back again. Sometimes it comes back bigger, and it has so many other symptoms that it causes, things like pain, itching, and the fact that it's just in places where people will tend to see, and a lot of people just don't like the appearance of them. So it is very distressing. What causes keloids? They can come from injuries. That injury can be an accident that you have had, and you've had a wound that heals. Initially, it heals like it's a normal wound, and then suddenly it starts to grow, gets very big. And the thing about keloids is that it does not stay in the zone of the wound that caused it initially. It grows on top of that wound, and it goes into the skin that is nearby that was never even injured in the first place. And so it forms a very huge and very abnormal looking scar. So a lot of people have a lot of discomfort with these kinds of keloids. Another thing that can happen is in people who have had burns. That's fire injury. It can be fire, it can be hot water, but anything that causes burns, as it's healing, it results in these very thick and huge scars. So a lot of people have lived with these things, and they have tried several treatment options, and it just keeps coming back. So that's that about what keloids are. So what do we do for keloids then, since they seem to be always coming back? Now, when you are seen in the practice, you have to be talked to. Obviously, we understand the fact that keloids are very distressing, so we understand that very much with you, and we understand the concerns you have regarding the repeated infection and pain and itching. So we'll ask you all these questions: how it started, when it started, and how it has been progressing. Has it been getting bigger? Have you done anything about it before and then it came back again? Or, just questions around that keloid itself. Anybody in your family that tends to have a similar problem, do you have it anywhere else? And do you have any procedures planned in the future? Because we need to advise you on what to do with those scars that can come from the surgery that you have planned coming up. And then we'll do a thorough examination, because we also need to know that you are well. We also need to know that you don't have any other problems, any other medical conditions, because some of the things we use to treat the keloids may worsen some of your medical conditions that you already have. Now, what are the possible treatment options that we have available at the practice? At the practice, after going through everything with you, we may want you to do some blood tests as well, just to be sure that everything is clear. And usually we like to start with procedures that are not very invasive. We do not like jumping to surgery right away, except in some cases. And then when we have talked with you, we've examined you, we'll let you know if you are the candidate that needs to go straight to surgery, because the first route of treatment is usually injections. So we'll prescribe some injections that we'll administer into the keloid itself. These injections are usually very effective. They can help to reduce the itching and the pain, and also the size of the keloid. And for some people, that may be the only treatment that is required. But you must also understand that just like with every kind of treatment, there are some side effects that can come. One of the most important side effects, especially in people of color, is that the skin around that area may begin to change color. So you may notice that the skin around that area starts to get very pale, as if you have been bleaching that area. Don't be afraid, it's not bleaching. If that happens, we just stop the injections. We give you some medication to help to correct that. But you must also understand that sometimes that change in color may be permanent. Or in addition to that, we may decide to do a surgery. So if we have reviewed you, we have looked at the keloid, and we feel that you need to go for a surgical procedure, we will let you know that as well. Now, surgery is never a standalone thing for the treatment of keloids. Surgery is usually something that we do in addition to other treatments. So when you come in and we have reviewed and we have checked all of that, everything about your keloid, we will decide what other treatments you need in addition to surgery. So thank you so much for watching my video. I hope I've been able to answer a lot of the questions bordering on your mind. So if you have more questions, I'll be very happy to answer. You can drop it in the comment section, and please do well to like and follow this page for more information. And also, you have our consultation details on this page. You may want to reach out and ask your questions. And if you want to come in and have a surgery done, we would also be happy to see you. We also offer virtual consultations, and we can let that option open to you depending on where you're located. So thank you once again for watching this video. My name is Margaret, a plastic surgeon living and practicing in Nigeria, and I'll see you in my next video.